Hey everyone, it's Derek with OPTP, and today we are going to answer three of the top questions that people will commonly have regarding sacroiliac joint pain. And to help us answer these questions today, we have Dr. Deb Riczo, who's a clinician and very qualified individual to help us answer these questions. She actually wrote a book titled Sacroiliac Pain, Understanding the Pelvic Girdle Musculoskeletal Method. Deb's going to help us answer some questions today, like I said, and we are very excited to have her on. Hello, Deb.
Hi, thank you for that lovely introduction.
Yeah.
I'm happy to be here.
Yeah, well, thank you. We OPTP appreciates you as well as our fans and customers. And we're going to start off with a question that you get a lot, I'm sure, and we hear often, which is, are my pelvic floor issues related to my back pain?
That's right. A lot of people don't realize that they can be. Of course, there can be situations where it's not, but it really can be related to back pain. Not that one causes the other, but and let's just take a look at the anatomy to understand why that can actually be. Before I share my screen, I wanted to just show you the pelvic model and the pelvic floor muscles, because a lot of times we think the pelvic floor muscles are just one piece of muscle like this, but actually it's a bowl. And there's a lot of connections with the muscles to the hips as well as to the spine, because everything works together like an orchestra. So I'm going to share my screen. So the pelvic floor actually has a lot of different functions. We know that it controls our urine, it's a sphincter and bowels, it supports our organs, it actually provides stability for our pelvis. It provides sensitivity for having sexuality and good sexual relations. And it also serves as a vascular pump. But the most important thing that we're talking about today in relationship to sacroiliac pain is that the pelvic floor muscle is a stabilizer in the pelvic girdle. It is one of the deep core muscles that help stabilize our whole trunk. And for example, when we're pregnant, and in delivery, those muscles really get stretched. And so not only do they get stretched or have problems because of pregnancy or postpartum, but males also can have problems with their pelvic floor and can also have low back pain, sacroiliac pain develop, or maybe the pain in the back came first, and then they started having problems with pelvic floor issues. So it doesn't necessarily have to be that one causes the other.
Okay, Dr. Deb. So the second question that we're going to go through is, can my sciatica be coming from my SI joint?
Yes, and that is commonly overlooked. We know that sciatica, of course, can come from the lumbar spine, but it can also come from the sacroiliac joint dysfunction or the sacroiliac region dysfunction. And if we look at the anatomy, that's going to make it a little easier to understand why. So this is a picture of the back of your hip. This is your buttock muscle, and then this part here is your thigh. This muscle here is the piriformis muscle, and that works together with these small muscles, and these are called hip rotators. The actual sciatic nerve runs right underneath the piriformis muscle. And in some people, it actually runs through the piriformis muscle. This muscle tends to get tight with low back pain and sacroiliac pain. You can see it's attached right to the sacrum. This is the sacrum right here. And this is the sacroiliac joint, and the spine is right here. So you can see everything is really in close proximity. When a nerve gets compressed, it doesn't like it, and it decreases the circulation, and it can cause radiating kind of pain and nerve pain. That also can come from the lumbar spine. It can come from both, because if the nerve is very irritated, it can become more sensitive. And this can cause pain down to the back of the knee, can also cause pain all the way down the leg.
Thanks, Dr. Deb, for answering that second question. The last one that we're going to cover here is related to some exercises. I know this is something that you get asked quite a bit. There's a lot of information about exercise in your book, But yeah, what are some things you can show us here to help with SI joint pain?
My book goes through a specific method that I developed called the PGM method, which is based on muscles and their dynamics. The screening exercise to determine whether or not you should proceed with the exercises in the book is what I'm going to show you right now. And this is called back extension. You're going to put your hands right on your lower back, and you are going to lean backwards, what feels comfortable, and you're just going to let your back sag, and you're going to blow out. And you're going to do that 10 times. Now, it may cause you pain, but if the pain stays in the back, then you can proceed with the exercises in my book. If it causes after 10 reps that your leg pain is shooting down is worse, then you need to go and get yourself evaluated by a provider. The second exercise is part of the PGM method, and this is to help loosen the rotator muscles that are in our hips. And all of my the PGM exercises in my books have videos so that you can actually see a live person doing the exercises. So you're going to take a big breath in, and your knees are going to go out and your toes are going to go out, and then you're going to exhale and you're going to pull your knees in and your toes in and do a gentle squeeze. Inhale, knees out, toes out. Exhale, knees in, toes in, gentle squeeze. If you can't do the ankles, that's fine until your muscles start loosening up more. You can add them in later. If you can't go out that far, you continue to do it and it'll loosen the muscles up. And there's progressions of this exercise in my book once you do gain the range and the flexibility for this exercise. You want to do this about 3 sets of 10 because we're working on getting the muscles to loosen up so they're not holding and compressing.
Okay, Dr. Deb, thank you so much for helping us answer some of those top questions on SI joint pain. I guess as we wrap up here, I want to direct everyone to optp.com to check out Dr. Deb's SI pain book. Of course, you can find a lot more in-depth information there. Also, Dr. Deb, if you want to quickly let us know about the other book that you have.
Yes, I have a book for pregnant and postpartum women because that's such a common time to be having sacroiliac as well as pelvic girdle pain. And the title is Back and Pelvic Girdle Pain in Pregnancy and Postpartum. And it is based on the same PGM method, but with the modifications that are necessary during this time period.
Perfect. Yep. So regardless of kind of where you're at in life, if you are pregnant or postpartum, or if you're just someone who deals with SI joint pain, make sure you go on to OPTP's website to check out these 2 books. If you're watching this during Pelvic Health Week, you can, of course, get a nice discount on either or both books as well. Dr. Deb, I wanted to also quickly note your social media channels, particularly Instagram, which is an area you share a lot of great useful content on as well, if you want to just quickly promote that.
Yes, my handle is Riczo Health Education, my last name, which is R-I-C like in cat, Z like in zebra, O, Health Education. I post daily. It's a holistic approach that I take and that I believe in, and I think you'll get a lot of benefit from that. I also would like to mention I do have a 15-minute free discovery call if you would like to talk to me and get some direction.